All right, we're going to go ahead and get started, guys. Welcome, everyone, to the Scope at Lunch. This is a special edition of the Scope podcast. My name is Paul Hackbarth, and I'm going to be your host for today. Before we get started,
Oh, Paul, you're muted somehow, tragically.
thank you. So let me just start on over. So good afternoon, everyone. Welcome to the Scope at Lunch special edition of the Scope podcast. My name is Paul Hackbarth, and I'm your host for today's webinar. Before we get started, I'm going to walk through a couple housekeeping items, and then we will introduce our guest today. So first of all, just be, for those of you who are on the Zoom, just be aware that the Zoom session is being recorded. We'd like to know who everyone is, so please ensure your name is accurate. And if you need help with us, just please reach out to us using that chat box feature here in Zoom. Again, I'll be moderating this session with my Phelps Health marketing colleague, Hillary McCash. So one of us will be sure to help you if you need it. Also, we'd love to see everyone's faces. It makes for a much more fun and interactive session. If you do feel comfortable turning on your camera, please do so. Also note that each of you is currently muted. If you have a question that pertains to the topic being discussed, you can add that question in the chat box there, and we'll try to get that question answered for you. You can also add comments in the chat box. One thing to note about the chat box is you can send a question or a message to everyone in the group, or you can just send to one person. If you have a question or comment, we would encourage you to send it to everyone, just so that everyone can participate in the discussion. But if you also feel more comfortable just sending a private message to either me or Hillary, please feel free to do that as well. So, in addition, we want to encourage everyone to utilize the reactions that Zoom offers. So you can use the hand clap, the thumbs up, the thumbs down, whatever you let us know if you like, love, or disagree with anything we're saying. Reactions can be found in two places. Either thank you, Max, for that great demonstration. So reactions can be found at the top or bottom of your screen, and you also see one on the participant list as well. So, and if you're watching us from our Facebook live stream, also hello, and feel free to ask questions, comments, or show us emoticons during this conversation. We will be conducting a poll here on the Zoom meeting, so you'll get a chance to interact here shortly if you choose to do that. And some of you may be using a mobile device, some of you may be using a laptop or a computer. If you find that your features aren't the same, just again, reach out to me or Hillary, and we'll be happy to help you make sure you can participate in any way you can with us. So if you have any issues with your sound, the Zoom meeting, or any other features, again, you can use the chat box to let us know, and our moderator will be happy to assist. So that was a lot of information. Let's go ahead and introduce today's experts. With us today is Max Tohline, is a recruiter, and Caitlin Roy is a nurse recruiter. They both work for Human Resources at Phelps Health. So welcome to the show, you two.
Thank you.
Hello, thank you for having us.
Yeah, so we're glad to have you with us. Max and Kate, I think this is your first time on our show with the Scope podcast. So before we get into our discussion, why don't you tell us a little bit about yourself? I'll pick Max to go first, if you don't mind.
Oh, no, I don't mind at all. I'm originally from Cincinnati, Ohio. So sometimes people say they can hear it in my voice. I don't hear the accent, but I imagine it's there somewhere, traces of it. But I've been in Rolla for a total of 15 years of my life, and in my spare time, I love arguing about movies, running my dog's Instagram, building and flying model rockets, and drinking really peaty scotch. So hopefully one of those things checks a box for somebody out there, and you're like, I'd hang out with that guy. And of course, as you said, I'm a recruiter here in HR. I'm on the side of HR that's trying to bring people in, as many people as possible. So send me your application. I want to read it.
Yes, and we have lots of job openings, so we'll talk more about that.
We're going to get to that real soon.
Yes. So, all right, Kate, want to go ahead and introduce yourself?
Yep, my name is Caitlin Roy. I'm originally from Decatur, Illinois. I grew up in a small town called Blue Mountain, not far from Decatur. My husband and I moved here to Salem in 2018. So we've been in the area since then. And in my free time, I enjoy horse riding. That's one of my great passions. So that's what I do outside of work.
Awesome. So, well, we appreciate you both being with us. Before I think we get into our discussion, I just want to start off with a polling question, just kind of see from our audience about healthcare careers. So since that's our topic today, so if I do this right, I'm going to hopefully launch a poll here. And I'll give you guys a couple minutes to answer that. So the poll is, do you or does someone you know currently work in healthcare? All right, and I'm going to share the results here. So it looks like everyone either does or knows someone who works in healthcare. So that's I think we're talking to the right audience today then. So
I was really hoping for a no on there, and
No.
by the end of the audience, or by
Well,
the end of the session, bring them over to yes.
yeah, so we tried. So we have some Facebook people too. So we'll see if they might have some comments as well too. So all righty, well, let's go ahead and just dive right into the discussion. So question one, guys, why did you choose to work in healthcare?
Ooh.
So I'll go first on this one. I have always had a passion for helping others. Working at the bedside, especially in the ED, is very rewarding. Our patients come in, they're very sick. And a lot of times you can see a difference in them before they're dispositioned, whether they are well enough to go home or if they're admitted. And just that kind of turnaround, just to see the work, the effort that you put in for these patients. And just being there for them during their time of need is just so rewarding. So that's mine.
All right, and Max, you want to answer that question too?
Yeah, I being perfectly honest, I never expected to work in healthcare, but a brilliant recruiter here in our department named Thomas Rye, who I was on a bowling league with, happened to say, hey, I know you've never considered a healthcare career, but you have this skill set, and I know you, and I like your personality, and I think you have the mindset to work here. And after he, kept floating that out there to me a couple of times, kept encouraging me, eventually I said, fine, I'll give it a try. And it turns out he was totally right. And I love this job. And I think, I don't know, there are probably a lot of people out there who might not think of themselves as the kind of person who would go into a healthcare career. But if, like Kait, you love helping people and you are interested in getting that kind of, I don't know, emotional reward from your job, knowing that you've made a difference, if you're interested in problem solving, if you're interested in never getting bored because there's always something new, a healthcare career is probably for you. You just don't know it yet. And that's why Kait and I are here to try to matchmake and get you into this organization. To let you know what it is that you can do and what role you would be suited for that maybe you've never even heard of before, but it's perfect for you.
Yeah, that's great, Max. So I too also never thought I would work in healthcare either. In fact, when I first heard about, so I work in the marketing department for those of you who don't know me, and I do a lot of the writing and content. And actually, one of the first questions I thought is, why would a hospital need a writer? But believe it or not, they do. Like Max said and Kait said, I mean, we have just a variety of jobs. And again, we'll talk more about that later. So yeah, great points, guys. So.
Yeah, it took me 38 years to find out, but I belong in healthcare.
Well,
And
it's
also,
never
I
too
hear
late.
they're hiring in the marketing department right now. Is that true, Paul?
We are too, yes. So yeah, so that's one of the many jobs open right now. So yeah, so all righty. Let's move on to question two. I think some of you guys might have kind of answered this. So, but how many years have you been working in the healthcare field? I know Max said you were new. Kait, how many years have you been working in healthcare?
So I have been in healthcare for the last 11 years. I started out as a CNA, right out of high school. I worked for 4 years at St. Mary's Hospital in Decatur, Illinois. And I graduated RN school in 2015, where I took a position at Decatur Memorial Hospital, also in Decatur. And in that position, I worked in the cardiac ICU. It was very exciting. We actually did open heart surgeries in that hospital. So as soon as the patients would come out of the surgery, they would come immediately back to our unit. So it was very critical. Just rewarding to see the patients turn around. They come in and they're needing this major surgery, and then 2 days later you have them up on their feet, they're walking, they're feeling much better. So I did that, and then they closed down half of our unit for some remodeling. So they were floating us all over the hospital at that point. And one day they said, "Hey, Kate, we're going to float you to ED." And I said, "Oh no, please don't do that to me." I never thought that I would be an ER nurse. I'm like, "Please don't do that." And they're like, "Well, you have to go." So I did it, and it was absolute craziness. And I surprisingly absolutely loved it. So eventually I switched to the ED at Decatur Memorial Hospital. And then I did a little bit of traveling because my husband decided that, we wanted to move here to Missouri. And then I eventually took a position here at Phelps Health in our emergency department.
Awesome. So, okay.
How'd you ever get to HR?
We'll get to that, I think.
We'll get to that.
Okay. Yeah. So, okay. All righty. So again, I know you guys kind of covered this. If there's anything else you want to add, though, what was about your first role here at Phelps Health? So
the ED for me.
Okay.
Yeah, and here in HR for me.
For you. Okay.
Yeah.
So and I've also been in marketing ever since I started here. I've been here for about 6 years. So yeah. So okay. So and again, you guys may have touched on this. If there's anything else you want to kind of add, though, but what has your career journey been like, and how did you choose the area in which you are currently working?
Very clever, Kate. You were waiting for this question to talk about how you got to HR.
Yes.
Yes.
Do you want me to answer first?
Yeah, sure.
Okay. Well, like I said, I'm originally from Cincinnati, Ohio, but I went to school here in Rolla back when the university was still called UMR, and back when I thought that I was supposed to go into engineering, but things change. And I eventually ended up going into film studies. And when it was time to become a film professor, amazingly, I got hired here at a school that now goes by the name Missouri S&T. Taught for 8 years as a film professor at Missouri S&T, and then everything changed a little over 2 years ago, just like it did for everybody. And now I'm a recruiter at Phelps Health. Again, it's a journey that I never imagined. Thankfully, some things stay the same through that journey, but you just got to be willing to roll with the changes, and maybe eventually things turn out better. So here we are.
That's great. So, and Kate, do you want to talk a little bit about how you transitioned to human resources? So.
Yes. So I don't know if you picked up in my story of my career journey, but I worked for 4 years at a hospital. And then after I graduated, I switched over to a different hospital. And I never thought that I would do that. I always thought, I've worked as a CNA for 4 years at St. Mary's. I would just get a job as an RN at St. Mary's. But the recruiter from Decatur Memorial Hospital came to our school months before we graduated, before I even thought, that I needed to be applying for an RN job. And she just expressed so much interest in us. She was so excited. She just couldn't wait for us to put our application in. She made us feel very important. And, some of my classmates who were also my coworkers at St. Mary's, we went back to work and we were like, "Hey, when do we put our application in?" And we didn't get that same kind of excitement. So long story short, I ended up, jumping ship and going to Decatur Memorial Hospital. So whenever I saw the nurse recruiter position posted, I thought to myself, I immediately went back to that moment before I started my, nursing career, and thought about how excited the nurse recruiter was for us and how she just could not wait for us to put our application in. And I thought, I could do that. I could have that kind of excitement. I'm already excited to be a Phelps Health employee. I can pass that on to potential employees and students. So last year in November, I was blessed with the opportunity to become the nurse recruiter for Phelps Health.
Awesome. So, All right, thanks, guys. So, all righty. So, whoops, let's go back one. So, yeah. Sorry, I'm just getting ahead of myself there. So, okay. Question 5, which types of healthcare jobs are most needed? Can you guys kind of talk about that?
Yeah, I'm going to make Kate answer this one.
Okay.
My answer to that is all of them. It takes a lot of people to run a 2,000 person employee, 2,000 person health system. When people think of hospitals, they think of doctors and nurses, but doctors and nurses cannot solely run a health system. We need everybody, housekeeping, dietary, maintenance positions. They are all in high need. Now, of course, we need LPNs and RNs as well, but it takes lots of hands to make a health system.
Yeah, that's great. I love that answer. I find that too. In fact, it reminded me of a story. I was actually, I think, like getting a sandwich at a local place, and they were asking me where I worked, and I said, "Oh, Phelps Health," and they were like, "Oh, are you a doctor there?" And I was like, "No." I was like, "I actually work in marketing," and but yeah, I think a lot of people when they think of healthcare, it's either a doctor or a nurse. But like you said, there's so many other jobs, other careers there that help make that hospital and health system successful. So.
Yeah.
That's one of the biggest misconceptions that we're always fighting against, is that people assume that it's just doctors and nurses and nobody else.
Yeah.
But just like Kate said, whatever roles you need to keep a 2,000 employee facility going, at some point we're hiring that person.
Awesome.
And some of those roles we're hiring all the time.
Yeah.
So expand your way of thinking about what it takes to work in healthcare, because it's way more than just doctors and nurses, but we need plenty of them too.
Yes. Yes. Great point. So, okay. All right. So this is actually kind of a good segue into my my next question here. I wrote this question. I really felt it. I'll just go ahead and read it. I don't like blood or being around sick people. Max is raising his hand too. He probably agrees. So are there healthcare careers that don't involve direct patient care? You guys kind of briefly mentioned this in the last one, but if you guys can kind of talk more about this.
Yeah, I don't know how Kate does emergency department work. It doesn't make any sense to me. I don't know how, I mean, God bless everybody who does. It's unbelievable. But yeah, I raised my hand on that one because I am very happy to be over in HR. Thank you very much. And I understand that a lot of other people feel that way too. So some of the roles that we're hiring for right now, for instance, we need a team of data analysts all the time to keep our health information systems running and to do quality improvement on that. We're always hiring for people in registration, people we call patient services representatives. They're the people who will meet and greet you when you come into a clinic and safeguard your personal information and schedule you and treat you courteously and professionally. We are hiring pharmacy techs and dietitians and plumbers and housekeepers. And there are a lot of roles that don't involve the kind of stuff that Kate sees whenever she goes back to the ED. So yeah, it's a much, again, broader slate of positions and roles that we're recruiting for than I ever imagined before I joined. And so again, we're trying to get the word out there to people that don't just think doctors and nurses. There's so much else that you can do in healthcare besides that.
That's great. Okay. All right. All right. Question 7. So technology obviously is always changing. It's constantly evolving, kind of just like the healthcare system in general. Can you guys kind of talk about how technology is affecting healthcare jobs?
So whenever I first entered healthcare, we still had mostly paper charts. So I worked as a CNA, and I also cross-trained to be a unit secretary. And in that position, we were not only answering call lights and phone calls, but also entering the doctor's handwritten orders into the health system, or to the charting system. Since then, now we have all electronic charting, which is super nice. And then for patients, we have the My Chart, so they have access to all of their results and their electronic chart. It gives them, I would say, more control over their healthcare. And then here shortly, we are going to have it changed so that their My Chart, as soon as the results are available, it's open to the patients as well. So we are no longer in the days where you went to the doctor and you're waiting 2 days for a phone call to let for the doctor to call and say, hey, this is what your result was. It's right there on your phone. So I think it's great for employees and for the patients.
And I bet we've got all sorts of cool new machines with new blinking lights too. I don't know some of the technical terminology here, but Kate was just telling me about, what is it, the Da Vinci, some sort of surgical system? Tell me about this.
We've got a Da Vinci robot in surgery, so that's super exciting. One of the services that we offer here at Phelps Health, so super exciting.
Yeah.
A robot.
Yes. Yeah, it's great. Yeah, just as Kate said, not only like on your electronic medical record, we have that, but yeah, Max, that's a great point too. We have some of just like the latest technology in medical imaging, surgery, there are MRI machines or CTs, all kinds of different technology to help better diagnose and treat patients too. So yeah, there's we just have a lot of great stuff, and a lot of people I don't think they realize that that we have this stuff here available in Rolla. They don't have to travel to other communities or cities like maybe larger metropolitan areas. We have a lot of that great stuff, technology here to help with patient care. So.
And that also means that we're recruiting for people to run these machines.
Yes.
All the time. And these are hard roles to fill. So,
Yeah.
you know, if you're interested in going into any kind of tech role that involves running one of these high-tech scanners, ultrasound, radiation, any of that, we want you. We want you real bad.
Yes. Yeah. Great point. Okay, so this next question is, can Max and Kate, can you talk about what is rewarding about working in the healthcare sector, and maybe what is something challenging about working in healthcare?
Okay, so here at Phelps Health, our mission is to provide high quality, accessible healthcare, and our vision is to be the preferred health system. So to watch all of the employees working together to meet these goals and to provide high quality care to the patients is just wonderful. Everybody's kind of like a family, all working towards the same goal. So that is super rewarding. Some of the challenges that I see are the differences in our customers. They're constantly changing. So you have new generations who, in our instance, if you're going to set up an interview, they want you to text them and say, hey, I have these dates and times for an interview. Whereas you have, some of the older generations that are like, no, do not text me for an interview. If you want me to interview, you better call me to set this up. I kind of ran into one of these situations. I went to a hiring event this last Saturday, and an older gentleman approached me and he said, hey, I go to Phelps Health, and he was just kind of making conversation, and he said, but that My Chart, he said, they send me messages in there and I don't know how to log into that. So, we're always trying to tailor what we do to, match our customers. So some people like the My Chart, some people would still rather their physician call them. So I think that it's important that we keep that in mind, and that we always, tailor what we're doing to our audience.
That's a great point. Yeah, because healthcare, we serve so many different people, so many different age groups, backgrounds, things like that. Yeah, that's a great point, Kate. So, okay, so Max, did you have anything to add to that one, or?
I mean, there are the kind of challenges that would go along with most any industry. Finding people who think of the position that they're going into as a calling and have that kind of dedication and have that kind of compassion that is required. I know that there are plenty of people out there with those feelings and those drives and those emotions deep inside of them, and it's just a matter of activating them and helping them understand. Oh my goodness, maybe healthcare is the sector I should go into. So much has changed over the past few years. And if I had never given healthcare a chance, I never would have found this job that I absolutely love. And so it is my hope that, again, through this meeting right now, but also through our recruitment efforts more generally, we can find people who never thought about giving healthcare a chance, but will realize how much they enjoy the challenge, how rewarding the challenge is, and find a calling that they never knew that they had.
Yeah, that's great. I love how you said that, Max. Great point. So. All righty. So as we're talking about maybe people who are looking for healthcare jobs, what type of skills are healthcare employers like Phelps Health looking for in their employees? So.
Well, it depends on the job, obviously. There's a lot. But if we could say more generally, I hear this from managers who I talk to all the time. Managers will say, I just need somebody with that compassion, that empathy, that drive for customer service, and I can train everything else. Or I just need somebody who can keep their head cool while several pots are boiling over and is a good problem solver, and I can train for everything else. And so I think that those soft skills are more important than they have ever been. Obviously, there are plenty of roles that require some sort of specialized training or degree or certificate. And I know we'll talk about those more later on, but imagine my surprise when I found out that my years of being a film professor somehow gave me overlapping skills with the skills it takes to be a successful recruiter. I never expected that. But like I said, in most cases, we can train you on exactly how to use the database systems that you've got to type stuff into, as long as you're a person who is willing to meet those challenges, wants to be detail oriented, wants to be resilient, wants to provide quality care, wants to be compassionate, and wants the rewards that come with having done a good job like that. As long as you're that person, the rest will probably take care of itself. And at least that's my outlook on it.
Yeah, that's great. I love how you said that. Yeah. So yeah, just I mean, like you said, I mean, nurses are always going to have different skill sets than maybe like your engineering or patient service reps. But yeah, like I said, I think there's a lot of common just things that we're looking for, like you said, and you mentioned a lot of those. That's great.
Right, because everybody has to be on board with that Phelps Health ethos, with the Phelps Health mission, that it is our number one priority to treat anybody who walks through our doors like our number one priority, like family, like someone who is probably not having the best day if they walked into a hospital. Like that's just the reality of a lot of people you run into. They're having a hard time, and we are here to make it easier for them and to maybe think a few steps ahead and anticipate their needs before they think of them. And if you're the kind of person who can do that, again, the specialized training we can probably take care of that piece.
Yeah, that's great. So yeah. Okay. All right, moving on to our next question. We kind of got into this or kind of touched on this last time. And again, this question is sort of general for each career path in Phelps Health. It might be different, but what kind of education do you need to work in healthcare? Can you or Kate kind of talk about that?
Yeah, it obviously varies a lot. As you might imagine, like if you're going to be a provider, if you're going to be a doctor, for instance, obviously that takes a lot of education. But again, those aren't the only roles we're hiring for. Those aren't the only roles we're recruiting by any means. There are some positions where all it takes is a high school diploma or a GED. Some don't even require that. And there are other roles where even if you have never worked in direct patient care before, but you want to get into that, we can hire you as a patient care assistant and train you how to do that. Twice annually, we have something called the PCA Academy, which is this structured training environment, the structured training program that allows you to learn the basics of direct patient care, get your foot in the door in healthcare, and work your way up from there. And I think we'll talk probably in a moment about some of the extra opportunities for how you can grow yourself and grow your training and grow your certifications over the years, that you don't have to start right at the top. You can work your way up over time, and it's probably even better to do it that way because you're making money while you're learning, while you're training.
Yeah, That's great. So, yeah, I mean, maybe, well, your answer to that one and the one before, it made me think of this. I went to school for communications. That's what my degree is in. But and again, my background is in journalism. I never really worked in marketing before. So much of what I know now was I learned on the job and learned that training, through my team and the supervisors and things like that, and through the training that Phelps Health offered. So, like I said, even for something like you said, maybe like I said, I didn't know much about marketing before I came in here, but you can learn so much. I think Phelps Health is great about giving our employees those opportunities. So.
And who knows, maybe people just assume that they need to know everything coming in day one because they've worked in other positions where that's what was expected. But that's just not the culture here. Or it's certainly not the culture that I've experienced.
Yeah.
It feels like a family, it feels like a team, and everybody here has the same goal, and we're all working to that goal. And I have never had a moment in my career here where I didn't feel like I was being 100% supported by the people I was working with.
Yeah,
and
that's great. And that's
Kate's one
really
of those
important.
people, right? And you're one of those people. Even we work with marketing.
Yes. So yeah, it's really great to have that environment. Makes that job so much difference in a job to have that positive environment.
Yeah.
So okay. All righty. So yeah. So say that like I said, I want to continue to grow and expand my education as I'm working here. What sort of opportunities does Phelps Health offer, and how do we as an organization help support our employees' continued education?
So as we've discussed, we are all about career growth. If that is something that you want, Phelps Health offers to full-time employees a tuition reimbursement program. So if you're working on an undergraduate degree, they will pay up to $4,000 a year towards your education. And then if you're going for a graduate degree, you're eligible for $5,250 towards your education. So lots of great opportunities to take advantage of while also being paid, to work here.
Yeah, that's great, Kate. Thank you. So, yeah, I think that's a really cool, and we're going to get into the benefits on our next question. But yeah, I think that's one of the great benefits that Phelps Health offers. So. All righty. So speaking of benefits, what other benefits does Phelps Health offer its employees? I know when a lot of people are looking at jobs, they want to look they want to know what benefits an organization offers. So can you guys kind of walk through some of that?
So many. So many that if you want the rundown, you can go look at like a kabillion page PDF at phelpshealth.org/careers, click on benefits, and it just goes on and on and on. But yeah, so here's the quick version, right? That I've just typed out my notes here so I don't forget any. First things first, nobody working at Phelps Health makes anything less than $15 an hour. That's the absolute minimum starting rate, no matter what job you've got here. And most jobs make a lot more than that. But just know we're not going to slide you into something any lower than that. And especially when you throw shift differentials on top of that, when you throw experience on top of that, when you throw, any other kinds of education and certifications that we can credit you, those numbers just keep going up. I know I'll make Kate speak to the nursing side of this probably in a moment, but I always like to start with that. If you're working at least 16 hours a week, so that's only 40% of full-time. So if you're a part-time employee at that level, you start being your benefits eligible at that level, which means that you qualify for our 401k program, which offers up to a 6% employer match, meaning you put in 2%, Phelps Health matches that dollar for dollar. You put in 6%, Phelps Health puts in 6%, up to 6%. So, max it out. It was one of the first things I did when I got here, and I'm already rolling in the dough. Okay. But obviously we've got, health, life, dental, vision, all the insurances. We've got discounts for medical care, even if you don't take our benefits. We've got an employee pharmacy discounts, rock bottom prices at the cafeteria. Am I right? I'm always amazed when I go in there, and get a sandwich and find out how inexpensive it was, and it tastes good too, amazingly. If you work full time, your paid time off starts to accrue the second you start. Yes, thank you for putting the Hillary clutch play here, putting the link there in the chat. I really appreciate it. But yeah, if you work full time, the PTO starts accruing on day one, and you get about a full day's worth of paid time off for every 2 weeks of full time work that you do. It's about that. I'm rounding off a little bit, but that's an incredible rate. And on top of that, special sick leave, paid parental leave. We have this program called the CARES Award Program that goes around and recognizes people and departments who are doing an awesome job. They get nominated by their fellow employees and then get recognized. $22,000 worth of prizes annually for the CARES program. On top of all the differentials that I mentioned, certain roles qualify for sign-on bonuses. It would almost be faster to talk about the benefits we don't offer than to talk about the benefits we do offer. There's a lot. So go click on that link and, I don't know, start salivating, because there's a lot, or celebrating, whichever.
That's great. So Kate, did you have any benefits that you want to talk about on the nursing side, or?
I just wanted to mention that we have recently increased the pay for our LPNs. So our clinic LPNs are now starting out at $18.25 an hour, and we will pay for experience on top of that. And hospital bedside LPNs are making $20.25 an hour, and also we will credit experience. And then the hospital bedside direct patient care nursing areas are starting off at $27 an hour. And of course, we love experience on top of that too. So.
Awesome. Yeah. So, yeah, that's
hey,
great.
What if they don't want benefits, Kate? If they're an
Oh,
RN and
yes.
they don't want benefits, what happens then?
Yeah, how can I forget this? So if you are an RN and you do not need any of the hospital provided benefits, we offer a wonderful program. It's the internal agency program. So you're still a hospital employee, but you just don't accept any of the hospital provided benefits, and you're paid at a rate of $38 an hour. So super, super good opportunity for those that, do not need the benefits.
Yeah. Wow. That's amazing. That's great. So awesome. And yeah, as like I said, Hillary, my colleague, put that link to the benefits page on there. We want to get that word out about that. So it's no secret what our benefits are. We want to share that. So so check out some of the great benefits on there, on that page. So. All right, question 13. Can you guys kind of walk through what does the application and interview process look like here at Phelps Health?
Okay, so I get it. Nobody likes filling out an application. Let's just say that. Let's just get that out of the way. It's the worst. It's dealing with any kind of online bureaucracy. It's just terrible. But we try to make the new employee hiring process as easy and as painless as we can. So I just want to say that when you roll up at phelpshealth.org/careers and you click on search jobs, you can type in the name of a position or maybe even a partial name of a position, and it'll do its best to show you those positions. If you don't type in anything and you just hit search, it'll list every single open position that we're recruiting for right now, which is 150 of them. Tons of them. So there are lots of opportunities. Sometimes I encourage people to do that and just scroll until they see something that meets their experience and interests, because you never know what you might be suited for until you take a look at what is out there. But also part of figuring out that matchmaking, that's our job too, as recruiters. So if you can just find one position on there that you think that you might be interested for or interested in and qualified for, just click through that and do the application process. Fill out an application. You only have to do it one time. As long as you're always scrolling down to the bottom and signing and hitting submit and making sure you do that until there aren't any more sign and submit buttons to hit. Keep doing that until you get the confirmation email, and then your application enters our system. And then at that point, if you feel like picking up the phone and calling me or sending, one of the recruiters, somebody in HR, an email and saying, hey, I don't feel like filling out another application, would you please forward my application to other open positions? That's one of the many awesome services that we provide. Also, the second we have your application and your resume, we can look at it and be like, hey, I know you've never heard of, an SBO specialist, but you've done like clerical billing, coding work before, and SBO means single billing office. I think you'd be perfect for that. We can try to hook those things up for you and send you toward jobs that again, might meet your interest and experience. That's part of our role. So all you have to do is get that. Yes, staff contacts. Thank you. All you have to do is get that application in there once, and then reach out to us and let us let us know that you're interested in more stuff, and we will do the legwork to make sure that your application goes where it needs to go. And we'll even suggest some other places maybe where it can go.
Yeah, that's awesome, Max.
That's my side of it. What do you got, Kate?
I think that was perfect. We just always remind everybody, if you didn't receive a confirmation email, we didn't receive your application. So sometimes it's just some small little glitch. You just have to go back through and maybe re-enter something, or make sure you hit submit enough times. But yeah, as long as you've gotten that confirmation email, we've gotten your application, and feel free to call us anytime if you want updates, or like Max said, if you want us to reassign your application.
Yeah, and I love it when people call, because sometimes, sometimes a hiring manager will get really busy and they just won't have the time to be able to hire somebody this week. And if you reach out to me and say, hey, what's the status of my application? That gives me the perfect excuse to ring up the hiring manager and says, hey, we get a move on. Let's give this person an interview. So it makes my job easier when you reach out to check on the status of your application. So yes, reach out and we will make this happen.
All right, that's awesome. Yeah. And as we mentioned earlier, don't forget to check the chat box. Hillary put some great links in there about a link to our current job openings, and then our contacts there at the staff at the Human Resources if you have questions. So.
Yeah, Hillary is rocking the chat box right now. Well done.
All right.
Thank you all.
So question 14, what types of job shadowing or internships are available at Phelps Health?
So we offer a career skills program, and it is designed for members of the military looking to transition into the civilian sector, so that we participate in that program. We also partnered up with Mid-Missouri AHEC to offer job shadowing. So their mission is to grow and support Missouri's healthcare workers. They do a wonderful job with supporting students and anybody looking to do a job shadowing. So if that would be something that you would be interested in, I would recommend that you reach out to Tim Shopley. He is, part of the Missouri AHEC. It's a wonderful program.
Awesome. Okay. Thanks, guys. So.
More links. This is amazing. Look at how technology is changing the face of healthcare. Links in Zoom chat.
Yes, this is the perfect example. So
yes.
All righty. Earlier, Max and Kate, you guys shared your journeys with us through the healthcare or starting the healthcare journey in some cases. So looking back on that, what is something you wish someone would have shared with you as you began your career journey to where you are now?
This is my favorite question. And I just want to address anybody out there who maybe you're not listening live. Maybe it's months later. Maybe the Earth is a wasteland and you're a robot in an orbiting satellite now, and somehow you found this video clip deep in the future. You do not need to wait for any future date to start your career in healthcare. You can start your career in healthcare right now. That's something I never knew, and something I wish I had known a long time ago. Not just to give healthcare a chance, or that healthcare is much broader than you might have thought it was, because it's not just doctors and nurses, but regardless of what kind of role or career path you want to go into, whether it's clinical, non-clinical, whatever, you do not need to wait. We talked earlier about how you can start with no experience at all as a PCA, and how you can take advantage of the PCA Academy, or you can take advantage of tuition reimbursement to continue studying while you're getting paid and work your way up. This is why I say you don't need to wait until you have some sort of big, shiny, fancy degree before you come back. You can start your career right now. That's the big message I want to get out there. And that's why this is my favorite question.
Well said, Max. So, Kate, is there something you wish someone would have shared with you? So.
The sky is the limit in healthcare. So if you can believe you can do it, you can do it. Especially here at Phelps Health, you have the backing of everybody for career growth. So no dream is too far out of reach.
Okay, I love it. Those are both great things. I love that.
Yeah, and when you're ready to stop bouncing around between a lot of different jobs because you're not sure what to do, maybe you're young, or maybe you're in a mid-career, midlife crisis type of deal, which is sort of where I was before I came here. If that's where you are, give healthcare a chance and decide, hey, if I want to be at a place that feels like I have a calling at this place, I have a reason to come to work in the morning or in the afternoon or at night, depending on what shift you're in. If you want to feel like you have a reason to show up, this is an amazing career path for that. It will never feel like you're working for no reason when you're working in healthcare.
Yeah, that's great. Very well said. I think I mentioned earlier, I just celebrated my 6 years here at Phelps Health, and I realized this is the longest job I've had. Like that's the longest job that I've stayed with. So I think that speaks a lot to the culture here and just all the other great things you guys have mentioned earlier. So. All right, we got a couple more questions here and then we're going to wrap up. You guys have all gave us some great reasons to work at Phelps Health here today. Is there any other things you can think of why you recommend working at Phelps Health?
So I've been here a little over 4 years, and I've said this many times throughout my career here, is that this is by far the best place I've ever worked. It's just that, we are a larger facility, but we still somehow keep that family feel. It's, you can walk down the hallway and most of the faces, if not the names. And then, career growth. We have a lot of our VPs and our higher ups have started at entry-level positions here at Phelps Health. And I don't know about you guys, but those are the kinds of people that I want to work for. The ones that know how to do the entry-level jobs. They know what it takes to keep this whole facility going, and that everybody is just as important as somebody else. So just because of that, it makes it a wonderful environment to work in.
Yeah, I love that.
You know what else? I'm going to throw another stat on here. During COVID, we didn't furlough anybody.
Right.
There might be other hospitals that are teetering on the brink of extinction, other healthcare systems that are going the way of the dinosaur, but we're flying high. We care about our people. We didn't furlough anybody during COVID. And if you want to know that you are going to continue to have a job, if you're going to have a career, if you want to be able to have a career, there are plenty of them to be had around here. It just is a matter of whether you have that level of dedication and compassion and problem solving and resilience. Is that the kind of personality you have? Well, then great. We want you and we'll keep you. We'll fight to keep you.
Awesome. So great. All right. And I think that brings us to our last question. How can I learn more about careers at Phelps Health, guys?
I made a QR code. Click on the QR code, phelpshealth.org/careers.
So I love it. Yeah. So yeah,
Or use Hillary's link. I'm sure Hillary's link. She's sharing another link. Use the link.
Go.
It's easier.
Yeah, that's like I said, that is a wealth of information on that page. So go to it, share it with your friends. I think Max and Kate would agree with that, and to learn more about that. So we're going to go ahead and wrap up. Are there any questions? I don't think I've seen any come through, which I guess means you guys have just done an awesome job. So, so if we don't have any questions, we'll go ahead and wrap this up. So, and again, I just want to thank you guys. Thanks again for everyone for tuning into the Scope at Lunch, and a huge thanks to Max and Kate for joining us today. We appreciate all the insight you've been able to share with us. So thank you guys.
Yep. Thank you for having us.
Yeah. So as a reminder, this show has been recorded and it will be emailed to participants, and it can also be rewatched on our Facebook page. As Max said, I don't know if it will be still here when the wasteland is there, but hopefully it'll be there for a long time, hopefully. So so you make sure to share that with family and friends who may have missed this show. And then if you like the Scope and would like to know more, you can check out other episodes of the Scope on our YouTube page or phelpshealth.org. So with that, I'll let everyone have a good afternoon, and we'll see you next time.